Hey there. So today we're going to be taking a deep dive into anemia.
Okay.
You shared with me Dr. Rasha Eldeeb's physiology handout,
Yeah,
and honestly, there's some really fascinating stuff in here that I think we need to unpack.
for sure.
We'll be exploring the different types of anemia,
Okay.
the crucial role of iron and B vitamins, and even how this all ties back to the circulatory system.
It's amazing, isn't it? I mean, most people just think anemia is like, oh, I'm low on iron. But Dr. Eldeeb's handout really shows it's so much more than that.
It really does. It's not just about the amount of iron, but the overall ability of your blood to carry oxygen effectively.
That's exactly right.
It's really
You
interesting.
can almost imagine your red blood cells like tiny delivery trucks carrying oxygen throughout your body.
Okay.
And so anemia means you either have fewer trucks or the trucks aren't working the way they should.
Okay, I'm liking this delivery truck analogy.
Yeah.
So let's break down what causes these shortages.
Sure.
Dr. Eldeeb outlines three main categories.
Yeah. So the first one is hemorrhagic anemia,
Okay.
and it's pretty straightforward.
Okay.
It's caused by blood loss,
Okay.
which could range from something as simple as a nosebleed to more serious conditions like ulcers.
So anything that causes significant bleeding
Exactly.
can lead to this type of anemia.
And it's not just internal bleeding either.
Okay.
Dr. Eldeeb even mentions a parasitic disease called bilharziasis,
Bilharziasis.
Yeah.
Okay.
which can cause blood loss in the intestines or the urinary tract.
Bilharziasis, that's a new one for me.
Yeah, it's a parasitic infection that's found in certain freshwater snails,
Okay.
something to keep in mind if you're ever swimming in lakes or rivers in affected regions.
Noted. Okay, so beyond blood loss, what else can cause anemia?
So the second category is decreased red blood cell production.
Okay.
So if hemorrhagic anemia is like a shortage of delivery trucks,
Right.
this is like having a problem at the factory where the trucks are made.
Okay, I'm following you.
Okay.
So what could cause problems at the red blood cell factory?
Well, one possibility is aplastic anemia,
Okay.
where the bone marrow itself, the actual factory, is disrupted.
Oh, wow.
This can be caused by exposure to radiation,
Okay.
certain medications, or even infections.
So it's like the factory equipment is malfunctioning.
Exactly.
Oh.
And then, of course, you have nutritional deficiencies.
Right.
And this is where iron deficiency comes in.
Yeah.
But it's not the only culprit.
Right.
Deficiencies in vitamin B12 and folic acid can also hinder red blood cell production.
This makes me think about how crucial a balanced diet is.
Yeah.
It's like making sure the factory has all the right materials to build those delivery trucks.
That's a great way to put it.
Yeah.
And then finally, we have the third category, hemolytic anemias.
Okay.
So in this case, the problem isn't a lack of production, but rather red blood cells breaking down too
Exactly.
quickly.
This can happen because of inherited abnormalities in the red blood cells themselves,
Okay.
such as in sickle cell anemia.
Where the cells have a sickle shape that makes them very fragile.
Right. I've heard of sickle cell anemia.
Yeah.
It sounds incredibly painful.
It can be, and it leads to all sorts of complications because those misshapen cells can block blood vessels.
Oh, wow.
But hemolytic anemia can also be acquired,
Oh.
meaning it's not genetic
Right.
and triggered by things like malaria snake venom or even certain medications.
Wow, that's incredible. It's not just what's going on inside our bodies.
Yeah.
External factors can really impact this too.
Absolutely.
Oh,
And that's why doctors use specific blood tests,
yeah.
including what are called hematological indices, to really understand what type of anemia a patient has.
I saw that term hematological indices in the handout. It sounds pretty technical.
Yeah, it is.
So exactly are they?
They're essentially measurements that provide information about the size and hemoglobin content of your red blood cells.
Okay.
It's like analyzing the specs of those delivery trucks,
Hmm.
their size, their cargo capacity,
Yeah.
and whether they're fully loaded or not.
Okay, so it helps doctors get a clear picture of what's going on with the red blood cells.
Exactly.
Okay.
And it's crucial for diagnosis and deciding on the right treatment approach.
Let's dive a little deeper into these indices then.
Sure.
Dr. Eldeeb mentions a few key ones like MCV and MCH.
Right.
What do those stand for?
MCV stands for mean corpuscular volume.
Okay.
It's simply a measure of the average size of your red blood cells.
So like measuring the volume of our little delivery trucks?
Precisely. If they're too big, we call them macrocytes.
Okay.
If they're too small, they're microcytes.
Gotcha.
And then you have MCH, which stands for mean corpuscular hemoglobin.
Okay, so MCV is size.
Yeah.
What does MCH tell us?
MCH measures the amount of hemoglobin in each red blood cell.
Okay.
Hemoglobin is the protein that actually carries the oxygen.
Right.
So it's like measuring the cargo capacity of each truck.
So a low MCH means the red blood cells aren't carrying as much oxygen as they should be.
Exactly.
Gotcha.
And then we have MCHC, which stands for mean corpuscular hemoglobin concentration.
Okay, we've got size and amount.
Yeah.
What does concentration tell us?
MCHC measures how concentrated the hemoglobin is within the red blood cells.
Okay.
Are they packed full of hemoglobin, or is it more diluted?
Okay.
It's like checking if the cargo hold of the truck is full or only partially filled.
So MCV is size, MCH is the amount of hemoglobin,
Yeah.
and MCHC is the concentration.
Exactly.
Got it. There is also something called the color index.
Right, the color index is a simple way to assess whether the red blood cells have enough hemoglobin.
Okay.
It helps determine if they're pale or not.
Interesting. It's like checking the color of the delivery trucks to see if they're running on full power.
That's a good analogy.
Yeah.
And using these different indices, doctors can classify anemias into different types based on the morphology
Okay.
or appearance of the red blood cells.
So what are the different types?
So Dr. Eldeeb mentions three main types.
Okay.
Normocytic, normochromic anemia, microcytic hypochromic anemia,
Right.
and macrocytic hyperchromic anemia.
Okay, those are some mouthful names.
They are.
Let's break them down. What's normocytic, normochromic anemia?
So in this type, the red blood cells are normal in size and have a normal amount of hemoglobin,
Okay.
meaning they look normal under a microscope,
Okay.
but there are fewer of them overall.
So the delivery trucks are fine.
Yeah.
There just aren't enough of them on the road.
Precisely.
Okay.
This could be due to something like acute blood loss or a problem with the bone marrow's ability to produce red blood cells.
Okay, that makes sense.
Yeah.
What about microcytic hypochromic anemia?
Here, the red blood cells are smaller than normal and have less hemoglobin,
Okay.
making them appear pale.
Okay.
This is often associated with iron deficiency.
So this is where our iron deficiency comes into play.
Exactly.
It's like the delivery trucks are smaller and can't carry as much oxygen.
A perfect analogy. And finally, we have macrocytic hyperchromic anemia.
That's the one with the larger red blood cells, right?
Yes. In this type, the red blood cells are larger than normal and often have an increased amount of hemoglobin.
Okay.
It could be a bit counterintuitive.
Yeah, it does sound a bit strange. If the red blood cells are bigger and carrying more hemoglobin, why is that a problem?
Well, while it may seem like having bigger trucks with more cargo is a good thing,
Right.
it's often a sign of an underlying issue.
Okay.
Most commonly, a deficiency in vitamin B12 or folic acid.
Okay.
These nutrients are essential for the proper maturation of red blood cells, and their absence can lead to these large, somewhat dysfunctional cells.
Okay, so we've got our three main types. Normal looking, but fewer.
Yeah,
Small and pale,
Huh.
and large, but potentially dysfunctional.
exactly.
And all these different types can stem from various factors like blood loss,
Right.
nutritional deficiencies,
Yeah,
or even problems with red blood cell production.
exactly.
A lot to keep track of.
It is.
And it really underscores why a proper diagnosis is crucial for determining the appropriate treatment.
Absolutely.
Now, speaking of treatment,
Yeah.
let's talk about the role of iron, since that seems to be a major player in all of this.
Definitely.
Dr. Eldeeb's handout goes into quite a bit of detail about iron metabolism.
Yes.
Why is iron so important for our bodies?
Well, iron is essential because it's a key component of hemoglobin,
Okay.
the protein in red blood cells that actually binds to and carries oxygen throughout the body.
Right.
Without enough iron, our bodies can't produce enough hemoglobin, leading to those oxygen shortages we discussed earlier.
So iron is like the fuel that keeps those oxygen delivery trucks running.
That's a great way to think about it.
Yeah.
And what's fascinating is that our bodies have these intricate mechanisms for regulating iron absorption and utilization.
Oh!
It's not as simple as just eating iron-rich foods.
That's intriguing. So how does our body actually absorb iron?
Well, most of the iron in our diet is in a form called ferric iron,
Okay.
which isn't easily absorbed.
Oh,
Luckily, our stomachs play a crucial role here.
okay.
The gastric acid, or hydrochloric acid in our stomachs, helps convert that ferric iron into ferrous iron,
Okay.
which is much more readily absorbed.
It's like the stomach preps the iron for absorption.
Exactly.
What happens next?
Once it's in the ferrous form,
Okay.
iron can be absorbed through the lining of the small intestine.
Gotcha.
And vitamin C actually helps with this process too.
Really? I didn't realize vitamin C played a role in iron absorption.
It does.
Wow.
Vitamin C helps form soluble iron complexes that make it easier for the body to absorb the iron.
So we have the stomach acid converting the iron into a usable form,
Yes,
and then vitamin C helping it get absorbed.
exactly.
It's a team effort.
It is.
What happens to the iron once it's absorbed?
It gets transported to the bone marrow,
Okay.
where it's used to produce hemoglobin for new red blood cells.
Okay.
Some of it's also stored in the liver and spleen for later use.
Makes sense. So our body is carefully managing these iron levels
Yes.
to ensure we have enough, but not too much. Because too much iron can be a problem too, right?
You're absolutely right.
Yeah.
While iron deficiency is a common concern,
Right.
iron overload can also lead to health problems.
Okay.
It can damage organs like the liver and pancreas.
There's that balance again.
Yes.
So it's like a delicate dance, ensuring we have enough iron for those delivery trucks, but not so much that it starts causing problems elsewhere in the body.
Exactly.
Yeah.
It's
Yeah.
a perfect example of how our bodies strive for that perfect equilibrium.
Okay. I think we've covered iron pretty thoroughly.
Yeah,
There was another key player you mentioned earlier, vitamin B12.
right.
What makes it so important in all of this?
Vitamin B12, much like iron, is essential for red blood cell production.
Okay.
But as Dr. Eldeeb points out, its role goes beyond just anemia.
Okay.
It's also crucial for DNA synthesis and the formation of myelin,
Okay.
the protective covering around nerve fibers.
Wow. So a deficiency in B12 can impact our nervous system too?
That's right.
That's crazy.
And what makes B12 so interesting is the journey it takes to get absorbed.
Okay.
It's not as straightforward as iron.
Okay.
It needs a special escort, if you will,
Yeah.
to be absorbed properly.
Hold on. A special escort for a vitamin. This sounds like a spy movie. Tell me more.
Think of it this way. Vitamin B12 needs a special pass to get into an exclusive club,
Okay.
and that pass is a protein called intrinsic factor.
Intrinsic factor. The VIP pass, I like it.
Exactly.
Where's this exclusive club located?
The ileum, which is the last part of your small intestine.
Okay.
That's where special receptors recognize the B12 intrinsic factor complex and grant it entry, allowing the B12 to be absorbed.
So if you don't have enough intrinsic factor,
Yeah,
B12 can't get absorbed.
exactly. It's like showing up at the club without an invitation.
Right.
And this is why certain conditions that affect the stomach lining, like gastritis or pernicious anemia, can lead to B12 deficiency.
Because they disrupt the production of intrinsic factor.
Precisely. It's like the factory that makes the VIP passes is malfunctioning.
Right.
And it's not just stomach conditions that can interfere with B12 absorption. Certain medications, like proton pump inhibitors,
Okay.
which are commonly used to reduce stomach acid,
Right.
can also impact this process.
Interesting. So even medications intended to help with one issue can have unintended consequences elsewhere.
It really highlights the interconnectedness of all the systems in our bodies.
Absolutely.
And speaking of interconnectedness,
Yeah.
let's talk about another important player in red blood cell development, folic acid.
Right. Dr. Eldeeb mentions that folic acid often works in tandem with B12.
Yeah,
What's the relationship?
both B12 and folic acid are crucial for DNA synthesis and red blood cell maturation.
Okay.
They're like partners in a construction crew working together to ensure those red blood cells are built correctly.
So a deficiency in either one can throw things off.
Exactly. And in cases of pernicious anemia where B12 absorption is impaired,
Right.
folic acid actually needs to be given alongside B12.
Okay.
This helps prevent worsening neurological symptoms.
It's like sending in backup to make sure the job gets done.
Ex-
Okay, so we've got iron B12 and folic acid all working together to keep those red blood cells healthy and functioning properly.
And remember, we can't forget about the circulatory system itself.
Oh, right. Yeah.
Anemia doesn't just affect the red blood cells.
Right.
It impacts how blood flows throughout the body.
That's right. Dr. Eldeeb's handout mentioned that anemia can put extra stress on the heart.
Yeah.
How does that work?
Well, think about it this way.
Okay.
When you have anemia, your blood becomes less viscous,
Okay.
meaning it's thinner and flows more easily.
Okay.
This can lead to increased blood velocity and even turbulence in the blood vessels.
So it's like trying to pump thinner fluid through the same pipes.
Exactly.
That would make the heart work harder, wouldn't it?
Exactly.
Okay.
And this increased workload on the heart can lead to fatigue, shortness of breath, and even heart murmurs.
Wow. I'm starting to see how even mild anemia can have noticeable effects.
Absolutely. And in severe cases,
Yeah.
it can lead to much more serious complications, even heart failure.
This is really making me appreciate the complexity of the circulatory system and how even slight imbalances can have a ripple effect.
It really is a testament to the delicate balance within our bodies.
Right.
And speaking of balance, let's circle back to iron for a moment.
Okay.
We talked about iron deficiency,
Right.
but what about the opposite, iron overload?
Right. We touched on hemochromatosis earlier,
Ah.
but I'd love to hear more about it. What exactly causes this condition?
So hemochromatosis is a genetic disorder that disrupts the way your body regulates iron absorption.
Oh,
Essentially, it causes your body to absorb too much iron from the food you eat.
so it's like the body's iron sensor is malfunctioning?
That's a good way to put it.
Yeah.
Instead of absorbing just the right amount,
Uh-huh.
it keeps taking in more and more.
Right.
Even when iron stores are full,
Okay.
and this excess iron over time builds up in organs,
Okay.
particularly the liver, heart, and pancreas.
And this buildup can cause damage.
Unfortunately, yes,
Uh,
it can lead to a whole range of problems, including organ dysfunction,
Wow.
cirrhosis of the liver, heart problems, diabetes, and even an increased risk of certain cancers.
That sounds pretty scary. Are there any early warning signs?
That's the tricky part.
Okay.
Hemochromatosis is often silent in its early stages,
Okay.
meaning people may not experience any symptoms until the iron overload has already caused significant damage.
So it's a bit of a silent threat. How is it diagnosed?
Blood tests can measure iron levels, transference saturation,
Right.
which we discussed earlier,
Yeah.
and ferritin, a protein that stores iron.
Okay.
If those tests show elevated levels,
Okay.
genetic testing can be done to confirm the diagnosis.
And if someone is diagnosed with hemochromatosis, what's the treatment like?
The most common treatment is phlebotomy,
Okay.
which is essentially the removal of blood from the body.
So it's like donating blood, but
Mhm.
with the specific goal of reducing iron levels.
Exactly.
Okay.
By regularly removing blood, you're removing excess iron along with it.
This has been a real eye-opener.
Yeah.
I knew iron was important,
Mhm.
but I had no idea that both too little and too much could be so detrimental to our health.
It's a perfect example of how our bodies need things in just the right amounts.
Right.
It's all about balance.
Absolutely. Okay, before we move on to the last part of our deep dive, I want to circle back to vitamin B12.
Okay.
We talked about its role in red blood cell production and the nervous system,
Yeah.
and about how it needs that special intrinsic factor to get absorbed.
Right.
But what happens when someone doesn't get enough B12?
Yeah.
What are the actual consequences?
Well, as we touched on earlier, B12 deficiency can lead to a specific type of anemia called pernicious anemia.
Right.
This is where the red blood cells don't mature properly,
Right.
resulting in those larger fragile cells we discussed before.
Right. The macrocytic hyperchromic anemia. So people with B12 deficiency would experience the typical anemia symptoms.
Right.
Fatigue, weakness, shortness of breath.
Exactly. But what makes B12 deficiency particularly concerning
Yeah.
is that it can also lead to neurological complications.
This is what I find so fascinating and a little bit scary about B12.
Yeah,
You're saying a simple vitamin deficiency can actually affect the brain?
it can.
Yeah.
Remember, B12 is crucial for the formation of myelin,
Right.
which is the protective covering around our nerve fibers.
Yeah.
When there's not enough B12,
Okay.
myelin production gets disrupted,
Right.
and this can lead to nerve damage.
So what are some of the symptoms of this nerve damage?
It can vary quite a bit.
Okay.
Some people experience tingling or numbness in their hands and feet.
Okay.
Others might have problems with balance and coordination.
Gotcha.
In more severe cases, it can even lead to cognitive impairment and dementia.
Wow. That's a serious reminder that something as seemingly simple as a vitamin deficiency can have far-reaching consequences.
It's definitely something to be aware of.
Yeah.
And what's tricky is that the neurological symptoms of B12 deficiency can sometimes show up before any of the anemia symptoms.
Oh, wow. So someone might be experiencing neurological issues but not even realize it's related to B12.
That's right.
Wow.
And this is especially true for older adults who are more prone to B12 deficiency.
Okay.
So if someone, particularly an older adult, is experiencing any unusual neurological symptoms,
Yeah.
it's always a good idea to have their B12 levels checked.
That's great advice. Now, I'm curious, if someone suspects they might be deficient in B12, what should they do? What are the next steps?
Well, the first step is to see a doctor and get a blood test to check their B12 levels.
Okay.
It's a simple and reliable way to determine if a deficiency exists.
And if a deficiency is confirmed, what's the typical course of treatment?
The most common treatment is B12 supplementation.
So it's just a matter of getting more B12 into the system.
Essentially, yes.
Okay.
However, the method of supplementation can vary depending on the severity of the deficiency and the underlying cause.
What do you mean?
Well, for some people, oral B12 supplements are sufficient. But in cases of severe deficiency or if there are issues with absorption,
Right.
like we talked about with intrinsic factor,
Right.
injections may be necessary.
That makes sense.
Yeah.
So it's not a one-size-fits-all approach.
Exactly. It's important to work with a healthcare professional to determine the right treatment plan.
Right.
They can help identify any underlying causes, determine the appropriate dosage, and monitor progress to ensure the treatment is effective.
Okay. So we've covered the different types of anemia, the importance of iron and B vitamins, and even how anemia can impact the circulatory system.
Yeah, it's pretty amazing.
It is. But there's one more thing from Dr. Eldeeb's handout that I wanted to touch on.
Sure.
She mentioned something called bronze diabetes, which is apparently linked to iron overload.
Right.
How does diabetes fit into all of this?
That's a great question. And it brings up an interesting connection between iron overload and diabetes.
Okay.
Bronze diabetes, also known as hemochromatosis-associated diabetes,
Okay.
is a type of diabetes that can develop in people with hemochromatosis.
So the excess iron buildup we talked about earlier can actually contribute to diabetes.
That's right. The excess iron can deposit in the pancreas,
Right.
the organ responsible for producing insulin.
Uh-huh.
Over time, this iron deposition can damage the pancreas
Oh, wow.
and impair its ability to produce insulin, effectively leading to diabetes.
Wow. It really is all connected.
It is.
It makes you realize how seemingly unrelated conditions can actually have common threads.
It's a perfect example of how seemingly isolated systems within the body are actually intertwined in complex ways.
So if someone is diagnosed with hemochromatosis, they should also be mindful of the potential for developing diabetes.
Absolutely. Regular monitoring of blood sugar levels is important for anyone with hemochromatosis, as early detection and management of diabetes can help prevent further complications.
This has been an incredible deep dive.
It has been.
We've gone from thinking about anemia as simply low iron
Right.
to understanding its many types, causes, and potential consequences. And we've seen how interconnected everything is, from iron and B vitamins to the circulatory system and even diabetes.
It really does highlight the complexity and wonder of the human body.
It does.
And it shows that there's always more to learn, even about conditions we think we understand.
Well said. It's been a pleasure exploring this with you.
Likewise.
And to our listeners, we hope this deep dive has empowered you with a better understanding of anemia.
Absolutely.
And perhaps more importantly, we hope it's sparked your curiosity to learn more about the amazing world within us.
Keep exploring, keep asking questions, and keep taking care of your incredible body.
Thanks for joining us on this deep dive into anemia.